So let's talk first about Parkinson's disease and the diagnosis. So Parkinson's disease, as most of you know, is a chronic progressive neurodegenerative disease that results in part from the death of dopamine-producing cells in a part of the brainstem, in the midbrain, the substantia nigra, although the disease is associated with other areas of degeneration throughout the brain. But this is the primary neuropathological finding and the finding that is associated with the primary symptoms of the disease. It's a fairly common disorder affecting approximately 60,000 Americans newly diagnosed every year with Parkinson's disease. And this results in about 1 million to 1.5 million patients in the United States who currently have Parkinson's disease, and 10 million patients worldwide who have the disorder. And with the aging of not only the United States, but the non-developed countries, we expect this prevalence to be much greater as we advance into the subsequent decades of this century. As most of you know, presently there is still no cure or disease-modifying therapies that exist in the treatment of Parkinson's disease, and thus current treatment strategies are focused primarily on the management and reduction of the major motor symptoms, although there are treatments as well for certain non-motor symptoms of the disease that we'll cover in the subsequent slides. Now, most cases of Parkinson's disease are considered to be idiopathic. That is, that there isn't a specific genetic abnormality associated with the disorder. About 5 to 10% of disorders, of diagnoses are associated with a specific genetic abnormality. And most cases of Parkinson's disease are believed to be due to an interplay of perhaps a genetic predisposition, which have been associated with certain environmental factors that can influence those who have a genetic susceptibility. And most diagnosed cases of Parkinson's disease do not have a specific environmental cause, although there have been associations with various environmental exposures, such as well water exposure, pesticide exposure, but there are no specific environmental causes associated with most cases of Parkinson's disease. Now, patients with Parkinson's disease have a higher direct healthcare cost, and this figure comes from a study done published in 2013, and you'll notice that there is a higher rate of direct costs, this is US dollars, in patients who have Parkinson's disease versus those age-matched controls without Parkinson's disease. And within the first year of diagnosis, these direct costs are 55% higher for patients with Parkinson's disease.